Hello, welcome to this AAACN podcast. My name is McLeod. I am from the University of Michigan. I am chair of the AAACN and Lippincott Task Force. I am here to present to you on how to develop a Lippincott procedure. So the first thing I'd like to do is a few housekeeping chores. I just want to make sure that everyone's aware that the evidence that's used inside the Lippincott procedure is current, it's evidence-based, and it's accurate. The references that you use for the source needs to be superscripted next to the information so we know where you got that piece of information from. Now, is the superscripting important? No. Linking the reference to the source, very important. If you don't superscript, that's okay. You need to do this as you move along in writing the procedure. If you wait to the end, you might not remember where you got your source of information from. This may cause you extra workload, and that's not what we want for you. Now, for those of you unfamiliar with superscripting or someone who wants to take on the superscripting is the numbers that are positioned slightly higher than the text on the line. How do you do this? You're going to select the text that you want to superscript. Highlight it, in other words. On your Home tab, in the font group, click Superscript. Or you can press Control, Shift, and the equal sign. It will superscript the number for you. So, what is a Lippincott procedure? Well, it's an online procedure manual. It's designed for nurses, physical therapists, respiratory therapists, and other clinicians. It is evidence-based. It is basically step-by-step instructions for completing a task. It also contains quizzes to evaluate learner comprehension. This helps managers and educators to assess staff competency. So doing your literature search, we've got some do's and don'ts. So your literature review. Number one, if you have a librarian, you may want to contact them. They have great ideas for search terms and search strategies. If you do not have a librarian, feel free to contact the task force chair. Now, some of the procedures actually might not have a whole lot of research evidence behind it. Then you probably need to go to national guidelines. If you are having problems, feel free to contact the task force chair. They are there to help you. So if you're looking for evidence in databases, what type of research is permissible and not permissible? Well, filtered evidence, which is primary, which is investigational or experimental, RCTs, great stuff. Unfiltered secondary reviews, systematic reviews, meta-analysis, that's absolutely fine. What we don't want is any of the gray literature. And what I mean by that is things that are unpublished yet, like dissertations. There are lots of databases you can use. People are very familiar with PubMed, CINAHL. There's also Web Science, Scopus, Embase, JAMA. There's lots of them. Timelines. We recommend 3 years or less for journals and books, 5 years or less for other types of research. Now, if it's a landmark study, it's okay, it doesn't need a timeline. Other sources, like I had said, there might not be any research on your actual subject, or the research might be so very old. You can use reputable sources, National Guideline Clearinghouse, national and international organization position statements and guidelines. Definitely, you can use them. When you use those position statements, though, what you probably want to do is go down their references and go look at their references and then hand search them. Do not use those secondary sources, the WebMD, the eMedicine, the Mayo Clinic. Those are not the ones that we want. Now, what you can do is go there and grab their references. That will probably save you time in searching. Documenting your search. Everyone should have received a literature search flowchart where it asks you what databases and what search terms you used, how many articles you got from there, how many were duplicates, how many did you keep out of there. What this does is this helps the editor and the reviewer to know where you went and what you did, because they might go ahead over to the same place, maybe put in different search terms, or they might go ahead and replicate it and see if they get something different by changing a word or two. So please use the literature search flow chart. If you do not have this, it is in my involvement on the AAACN website. All the references that you pull from databases, the research, needs to be leveled. The evidence has to have some type of leveling. We use Melnick for that, and here is a copy of it. It's also in your procedure template. Level 1 is a systematic review, meta-analysis. Level 2, well-designed RCTs. Level 3, well-designed control trials without randomization. 4, evidence from well-designed case control and cohort studies. 5, evidence from systematic reviews of descriptive or qualitative studies. 6, evidence from descriptive or qualitative studies. And 7, evidence of expert opinion or authorities. Now, if you're unsure, please contact your task force chair. They are there to help you go through this. Procedure writing, do's and don'ts. Creating a new procedure. There is a template that Lippincott gives you. It explains in detail the different sections, and it has an example to follow. When you are writing these, you should be following the standards for AAACN. If you do not have these standards, they are located in my involvement on the AAACN website. You're going to have several sections to go through when creating these procedures, and we're going to walk through them one by one. Now, you might get the opportunity to revise old procedures, and I guess it's really not old procedures, but they're inpatient procedures. So you can imagine taking a blood pressure might not change so much from inpatient to outpatient, but there are probably some changes. So you might have the ability just to revise that. So if that's true, that procedure will be sent to you. It's sent to you in a Word document. Cut and paste from that procedure document into your document. Do not go and retype everything out. We're trying to make this easy on you. Feel free to use their references. Feel free to add in your references. The sections are already there for you, so it's a matter of just plugging things in. Make sure you follow your standards for AAACN. What you don't want to do when you do these procedures is use brand names of equipments or medications. Instead, you want to use general terms, such as, this product is used by more than 1,500 facilities that use a variety of equipment and medications. And try and stay away from a lot of jargon. And that's special words and expressions that may be used by a particular profession, healthcare, that may be difficult for others to understand. Do use commonly used abbreviation. If you follow the Joint Commission's Do Not Use list and additional abbreviations and acronyms, if you look in your procedure template, there's some information in there for you. Now, when you do use acronyms, spell out the term at the first mention in the procedure, and then in parentheses, put its abbreviation. Like you see here in the example, Centers for Disease Control and CDC. Then the next time you need to mention CDC, you just mention CDC. Use practitioner. Don't use doctor or physician unless it can only be performed by a doctor. Feel free to add in pictures. I do not want you to worry about copywriting them. What I want you to do is, if it's a good picture, I want you to reference it. I want you to send it over to Lippincott with that reference, and Lippincott will take care of the rest. I want you to have fun when you're doing this too. So here's an example of the do not use list for abbreviations. Do not use U for unit. You actually want to write it out, unit. I think you know a lot of this from your daily work. Your introduction. It should be written in paragraph form. It should include just a brief overview of the purpose of the procedure, indications, precautions, contradictions. Here's an example of an introductory statement. So this statement is also in your procedure template. So we're not going to spend time going over it, but I want you to take a look at that. You see how it's short, sweet, to the point? Do you see how it's superscripted, where they got the information from? You see how they've also used acronyms in it. Great thing. The equipment section, we want you to write that as a bulleted section. So when people are gathering the stuff, they can quickly look down it. Think of it kind of like a recipe where you put all the ingredients first and then you tell them what to do with it. So an example would be tape measure, stockings of the correct size. Now, it's as if it's optional, you can list it, all under optional. Make sure that the list contains all the equipment that need to be performed. Yes, right down to the gloves. Now, the preparation of equipment is actually an optional section and might not be applicable. Use it when equipment must be performed before the procedure. If there is something, put it in paragraph form. So an example might be measuring the patient using a tape measure to ensure proper fit of stockings. And then you can also provide a sidebar piece to better explain the information. So let me show you what a sidebar piece is. This is what a sidebar piece is. It's just a little bit off to the side, a nice little square, and this is how you do it. So you could put it in paragraph form or the sidebar piece. The implementation section, write it as a bulleted list of complete sentences that begin with verbs. So short and sweet to the point. Verify, review, perform, step by step, in chronological order. Add the rationale for why you perform the steps in italics. Superscript the evidence. So here's an example. And all these examples I'm giving you, I took right from the procedure template. Examples, insert your hand into the stocking. But do you see how in italics they put the rationale for doing that? Then they superscripted the reference. Now, if you don't superscript, you just put a 4 there, we're happy. Include photos, illustrations, tables, graphics, whatever you need. Just reference where they came from. Lippincott will take care of the rest of it. Now keep in mind that someone who's never done this before could be doing it for the first time. And we want them successful. We want this easy for them to follow, and we want success in the end. Patient outcomes depend on it. The special considerations section, we also want this bulleted. So what we want is quick look, very easy to find. This is information that they need to know when performing the procedure. It isn't an actual step in the procedure, but it is important to know. So an example would be encourage the patient to wear the stockings day and night until his mobility is no longer least significant reduced. Now look, they superscripted their reference. Patient teaching is an optional section. It's in paragraph form. You only want to use this if the patient or family needs self-care knowledge. So you're not actually writing the patient education materials. What you're doing is you're telling the person who's performing the procedure exactly what they need to teach the caregiver. So for instance, if the patient requires these stockings after discharge, teach him or her, the family member, how to apply them correctly and explain why they need to. Of course, you see they superscripted their reference. Complications, that's also optional. Write that in paragraph form, make it brief. Include only complications that may occur as specific to that procedure. So an example, obstruction of arterial blood flow, and then explain what that is real quick. And then add in any less serious complications like allergic reactions, skin irritation. Documentation should be written in paragraph form. That should include the pertinent information for the clinician who's performing the procedure, whatever they need to document after the procedure. So this is according to regulatory guidelines, not institutional guidelines, but regulatory bodies say. An example is record the date and time, the stocking style, condition of the leg, condition of the toes, complication. Document your patient's understanding of the teaching, that you taught them to remove the stockings. Quizzes. I know most people are nervous about quizzes. Do not be nervous about them. 5 to 10 multiple choice questions. You're going to have 4 answers for them that they're going to pick from. When you're doing this, think of teach back. So what are the top 5 things that you want the nurse, the nurse to understand about the procedure? Short, sweet, simple. Make the first option the correct answer. Provide a rationale for the correct answer. Questions should only contain information that is in the procedure. And avoid any kind of negative questions like all of the following except. So here's a great example of a quiz. And again, this is in your procedure template. You notice first one's the right one, and they have the rationale in there. That's exactly what we want to see. Your reference section, please use APA 6th edition for referencing. Number your references to correspond with your superscripts, correspond with your sources. Add any additional references to the additional reference section. So what we mean by that is while you might have looked up information, you might not have used anything from it because it could be duplicate from someplace else. If you looked it up and it verified the same thing that you're doing or the same thing that is in others, please put it in the additional reference section. What it helps do is verify the accuracy of it. So we don't want anyone picking up the procedure and going, well, what did the AMA say? If you put in the additional reference section, then it says we looked at what they said, and they said the same thing that we're saying. Superscript your references when you can. Remember, that's not a priority. Level your evidence. That's a big one. People forget to do that. If you're having a hard time, contact your chair force or the chair of your task force. Final steps. Read through your procedure. Is it evidence-based? Does it contain the latest guidelines? Does it flow logically? Is it clear, concise, current? If a person who's never read it before, can they do it? Maybe you should grab a friend and have them read through it. Does it make sense to them? Make sure your steps are superscripted to the evidence base or just referenced. Make sure everything's leveled. The quiz is completed. Photos are in place. You have references in the photos. So I would like to thank you for taking the time to develop a Lippincott procedure. Your efforts are greatly appreciated. You are setting national standards for ambulatory care. Be proud of the work that you do. Thank you.